No, I will need you to fill this thing out yourself because you get some information where you need to know what to fill about. If not, you get to do the phone with me while they fill the thing. Is that your GPA for AIT, right? Alright, so I'll send you the link to the form. So fill them out and let me know when you finish. So you go create. Let me know when you finish. No, just fill out with him. Just fill out Good afternoon, everybody. I'm just waiting for Whitman-Walker to join so I can begin the learning.
They want the online game, it's just good you download it on the phone. They know where you are from. But if you can go on the computer, so would they be talking in and out on that too?
Hello, everybody. During the past few months, Whitman-Walker Community Health Department has expanded its outreach efforts to social media platforms. We cover various topics about HIV and STIs, sexual health practices, access to care, and social determinants of health, and public health integrity. The community health team is here to educate you. Hello, my name is Corey Haskett. I use he, him him, his pronouns, and today I will be talking about testing Chem Sex drugs for fentanyl. Facts about fentanyl. Fentanyl can lead to addiction. Fentanyl and other synthetic opioids are the most common drugs involved in overdose deaths today. Illegal fentanyl is being mixed with other drugs such as cocaine, heroin, methamphetamine, and MDMA. This is extremely dangerous because people are often unaware that fentanyl has been added. Fentanyl works by binding in the body's opioid receptors, which are found in areas of the brain that control pain and emotions. It 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 affects its effects include extreme happiness, drowsiness, nausea, confusion, constipation, sedation, tolerance, addiction, respiratory depression, and arrest, unconsciousness, coma, and death. The high potency of fentanyl greatly increases the risk of overdose, especially if a person who uses drugs is unaware the powder or pill contains it. They can underestimate the dose of the opioids they are taking, resulting in an overdose. Naloxone is a medication that can be given to a person to reverse a fentanyl overdose. Multiple naloxone doses might be necessary because of fentanyl's potency. Reduce the risk. Don't use alone. Have someone check on you if you're using alone. That way, if you do overdose, someone can intervene. Try a small amount first. Because fentanyl is so strong, a little goes a long way, and overdoses can occur quickly. Sometimes before you even finish injecting the dose. Have a overdose response plan. Having a plan to assist people helps to ensure that the overdose is not fatal. Don't mix drugs, including alcohol. Fentanyl is a dangerous drug, but combining it with other drugs increases the risk of an overdose. Learn how to use fentanyl test strips. Knowing what's in your drugs can help you decide how much and how best to use them. Always carry naloxone or Narcan. Be familiar with the signs of an overdose and be prepared to respond with naloxone, no matter what drugs are being used. So, how to test your drugs with fentanyl test strips. Fill a cup of water with approximately 2 teaspoons of water for testing opioids, or half a cup of water for testing other substances like methamphetamine, cocaine, MDMA, ketamine. Crush any pills and test the residue. Dissolve a tiny amount of the drug powder in the water, similar to as if it was a few grains of salt. Do not test shared shards or pieces. Swirl gently to the same amount of water. Hold the testing strip by the dark blue end. Do not touch the white portion of the strip. Dip the strip into the water and hold it for about 15 seconds. Do not insert beyond the thick blue max line. Place strip down on flat, non-absorbent surface for 15 minutes. Positive for fentanyl is one colored band. Negative for fentanyl is two colored bands. So before we go, let's give you some reminders about COVID-19 and vaccines. If you have already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself, your loved ones, and your communities from illness. The Delta variant is soaring across the United States at the moment and is totally understandable why you might want to continue wearing your mask. The vaccine is not 100% effective. More contagious variants are spreading, and there's few protocols in place to actually verify if someone has been vaccinated or not. Keep staying alert. If you haven't been vaccinated and you're looking for an appointment with Whitman-Walker Health, has COVID-19 vaccines available. Everyone that's 12 and older are eligible for a Pfizer COVID-19 vaccine. Everyone 16 and up are eligible to receive a COVID-19 vaccine. Please reach out to us at 202-207-24380 to make an appointment. If you're having trouble making an appointment with us for DC residents, you can find information for COVID-19 vaccine walk-up locations and eligibility at vaccine.dc.gov or by calling 1-855-363-0333. Track the speed of COVID-19 vaccinations by visiting coronavirus.dc.gov/don't wait. For Maryland residents, learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, visit the vaccination registration portal here. If you live in Montgomery County, visit their vaccination registration portal here. Or call 240-777-0311 to schedule an appointment. For Virginia residents, learn more about the Virginia vaccine process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC's guidelines for mask wearing, quarantining, and social distancing, and the like. It is very important that you get vaccinated. Discuss COVID precautionary measures with those around you. Be mindful of masking, keeping your distance, especially when you do not know whether a person has been vaccinated or not. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check out our website at whitman-walker.org for the most up-to-date information on our services and more COVID-19 resources and general Whitman-Walker services. Please call 202-797-4439. Follow some of our programs at WWH Family and at Real Talk DC _ and No Filter DC.